Betamil range. The betamil range include betamil cream. Betamil, betamethasone dipronate cream is a protein tropical synthetic corticosteroid protein twice belonging to class 3 of tropical corticosteroid. Betamil GM. Betamil GM betamethasone dipronate plus gentamicin sulfate plus betamethasone nitrate is a combination of a protein class 3 corticosteroid and broad spectrum antibacterial and antifungal agent for topical administration. Betamil M. Betamil M betamethasone dipronate plus betamethasone nitrate is a combination of a protein class 2 corticosteroid and a broad spectrum antifungal agent for topical administration. Betamil N. Betamil N betamethasone dipronate neomycin sulfate is a combination of protein class 3 corticosteroid and a broad spectrum antibiotic for topical administration. Composition. Betamethasone dipronate cream USP. Betamil cream topical corticosteroid. Betamethasone dipronate BP equivalent to betamethasone 0.05%. Cream base with propyl glycol. Appropriate OH added to be used only under medical supervision. Caution. Systemic absorption, especially under occlusion, may occur on prolonged use. Betamethasone dipronate with gentamicin and miconazole nitrate cream. Betamil GM topical corticosteroid and antibacterial and antifungal cream base with propylene glycol. Appropriate OH added to be used only under medical supervision. Betamil GM shall not be used continuously for more than 1 week without re-evaluation by the physician. Caution. Systemic absorption, especially under occlusion, may occur on prolonged use. Warning. To be sold by retail on the prescription of registered medical prescription only. Betamethasone dipronate with miconazole nitrate cream. Betamil M topical corticosteroid and antifungal. Warning. To be sold by a retail on prescription of dermatologist only. To be used only under medical supervision. Caution. Systemic absorption, especially under occlusion, may occur on prolonged use. Betamethasone dipronate with neomycin sulfate cream. Betamil N topical corticosteroid plus antibacterial cream base with propanoid glycol. Appropriate OH added. Warning. To be sold by retail on the prescription of registered medical practitioner only. To be used only under medical supervision. Caution. Systemic absorption on prolonged use and sensitivity to neomycin may occur occasionally. Indication. Betamil cream is indicated to treatment of psoriasis, contact dermatitis, atopic dermatitis, neurodermatitis, and senile pruritus. Betamil GM is indicated for steroid responsive dermatitis associated with bacterial and fungal infection. The condition include eczema, various types of dermatitis, psoriasis, lichen simplex, and planules, scleral and anogenital pruritus associated with secondary bacterial infection of skin caused by organism sensitivity to gentamicin, as well as superficial fungal infection of skin such as tinea pedis, tinea curis, and tinea corporis caused by T. rubric, T. meningopitis, and E. flocosium cutaneous candidiasis, and tinea versicolor. Betamil M is indicated for the treatment of steroid responsive dermatitis associated with superficial fungal infection of the skin. Betamil N is indicated for steroid responsive dermatosis associated with bacterial infection. The condition include eczema, various types of dermatitis, mm, psoriasis, lichen simplex, lanceolin, and anogensal pruritus associated with secondary bacterial infection of skin caused by organism sensitivity to neomycin. Dosage and administration. A thin film of betamil range cream is to be applied once or twice daily on the affected skin areas. Not more than 45 grams of the cream should be applied per week. The duration of therapy should not be more than 14 days. It should not be used with occlusive dressing. Early relief of symptoms is experienced by majority of patients, and clinical improvement may be seen quite soon on starting the treatment. However, candida infection and T-crucis and troposis should be treated for 2 weeks and T-pedis for 4 weeks to reduce possibility of recurrence. Patients with T varicella usually exhibit clinical and mycological clearing after 2 weeks of treatment. If no clinical improvement is seen after 4 weeks of treatment, the diagnosis should be predetermined. After 14 days, if the corticosteroid responsive dermatological disorder has regressed, only topical antifungal therapy should be continued. If recovered, if the said condition has regressed partially, then appropriate combination of topically antifungal with the lower potency corticosteroid should be instituted. In case of betamil GM, after 14 days, when the original disorder has regressed, then the treatment may require single ingredient preparation contains component similar to those provided by betamil GM. Clinical pharmacology. Betamethasone diprovate is a potent synthetic topical corticosteroid throughout the extract mechanism of action of corticosteroid is not known. They are known to produce anti-inflammatory and immunosuppressive effect in pharmacological dose. Betamethasone diprovate is effective in topical treatment of corticosteroid responsive dermatosis due to its anti-inflammatory, antipyretic, and vasoconstrictive action. Contraindication. Betamil range is contraindicated in patients with hypersensitivity to betamethasone diprovate, miconazole, gentamicin, and neomycin. It is contraindicated in presence of viral, fungal, or bacterial infection and tubercular or sympathetic lesions unless used with appropriate chemotherapy. Betamil range is not indicated for children under 12 years of age. Betamethasone diprovate, miconazole, gentamicin is contraindicated in patients who are hypersensitivity to betamethasone diprovate to other corticosteroid or to an ingredient in this preparation. Betamethasone diprovate, miconazole, gentamicin is also contraindicated to rosacea, acne, perianal dermalogitis, perianal and genital pruritus, hypersensitivity to any of the ingredient of the betamethasone depraved presentations contraindicated their use as does tuberculosis and most viral lesions of the skin, particularly herpes simplex, varinia, varicella. Betamethasone depraved should not be used in napkin eruption, fungal or bacterial skin infection without suitable concomitant anti-infective therapy. Use of betamil range skin preparation is not indicated in the treatment of primary infected skin lesions caused by infection with fungi or bacteria. Primary or secondary infection due to yeast, secondary infection due to Pseudomonas or proteus species, dermatolosis, and in children under 2 years of age, including dermatitis and nappy eruption. Preparation containing neomycin should not be used for the treatment of otitis externa when the ear drum is perforated because of the risk of ototoxicity due to the known oxidity and nephrotoxicity potential of neomycin sulfate. The use of betamil range in large quantities so on large areas for prolonged period of the time is not recommended or circulation where significant systemic absorption may occur. Warning and precaution. Patient applying betamil range in large quantities on large surface area for a prolonged period of time should be periodically evaluated for evidence of HPA axis supervision. If HPA axis supervision is noted, the drug should be withdrawn or frequency of its application should be reduced or should be submitted with the less potent steroid. Generally, recovery from supervision is rapid, reversible, and complete on discontinuation. If irritation develops, betamil range should be discontinued and appropriate therapy should be started. Betamil range should not be used in treatment of acne, rosacea, and periodic dermatitis. Children may absorb proportionally large amount of the drug and those may be more susceptible to systemic toxicity. Betamil cream occlusion must not be used. Local and systemic toxicity is common, especially following long continuous use on large area of damaged skin in flexuous or with polythene occlusion if used in children or on the face course should be limited to 5 days. Long-term continuous therapy should be avoided in all patients irrespective of age. Tropically corticosteroid may be hazardous in priosis for a number of reasons, including rebound pediatric use. Pediatric patients may demonstrate greater susceptibility to topical corticosteroid, include hypothalamic pituitary adrenal axis suppression and to exogenous corticosteroid effect than major patient because of greater absorption due to a large skin surface area to body weight ratio. HPA axis superpression causing syndrome, linear growth, retardation, delayed weight gain, and intracranial hypertension have been reported in children receiving topical corticosteroid. Manifestation of adrenal supervision in children include low plasma corticosterol level and absence of response to ACTH stimulation, manifestations of intracranial hypertension include the bulging, frontinelli, headache, and lateral papilledema. Used in pregnancy lactation. There are no well-controlled studies in pregnant women, nursing mothers. The usage of betamil range during pregnancy is advocated only when clearly needed and when the potential benefit outweighs the risk of the fortes infant adverse reaction. Betamil range is generally well tolerated. Sometimes string may occur. Occasionally, dryness of skin, pruritus, irritation, erythema, cracking, and atopy of skin may be seen. Rarely, treatment of psoriasis with corticosteroid is thought to have exacerbated the disease, so participating posterior from the disease, hence be careful. Supervision of the patient is required. Systemic absorption of topical corticosteroid can be produce reversible hypothalamic pituitary adrenal axis supervision, manifestations of Cushing syndrome, hyperglycemia, and glucoconia in some patients. Overdose. Topically applied corticosteroid can be absorbed in sufficient amount to produce systemic adverse effect. Excessive prolonged use of topical corticosteroid can suppress pituitary adrenal function, resulting in secondary adrenal insufficiency, which is usually reversible. In such case, appropriate symptomatic treatment is indicated if hypothalamic pituitary adrenal axis supposition is noted. An attempt should be made to withdraw the drug, reduce the frequency of application, or to substitute a less potent steroid. Storage. Betamil cream. Storage at 25 Celsius. Extrusion permitted between 15 Celsius and 30 Celsius. Protect from freezing. Betamil GM. Store at temperature not exceeding 25 Celsius. Do not freeze. Betamil M. Store at temperature do not exceeding 25 Celsius. Do not freeze. Betamil N. Store at temperature not exceed 25 Celsius. Do not freeze. Shelf life. Prefer carton or tube. Presentation. Betamil range. Each available in tube of 10 gram.